Thank you, Jeremy. Good morning. I'm so thrilled to be here with y'all this morning, especially in person. It's been a couple years. Thank you all for taking the time to be here with us today. As Jeremy said, I'm Sally Corley. I'm the Chief Operating Officer for the State Employees Insurance Board, and I have the wonderful job of welcoming y'all this morning. Thank you so much. I know Jeremy introduced all of our vendors. I want to take a minute to tell you a little bit about myself and my experience when I first came to work for the state. I didn't know anything about the benefits that were offered to state employees, and a very kind lady sat in the desk next to mine. Her name is Debbie, and all of the SEIB team has heard about my friend Debbie for quite some time. Debbie was kind enough to help guide me through the benefits, learning about what all it means to be a state employee. She made sure that I got my wellness screening done. She let the office know when flu shots were being offered. She made sure that we used our personal day first before using our other leave. All the things that we needed to know. She was a very important part of my life early in my career with the state. And we recognize that you all play the role of Debbie for all of the employees in your agencies each and every day. That's why we've invited you here today to help support you in that role. We want to make sure that you have the tools that you need to play that role for all of your employees. I know that health insurance can be a little bit dull, let's say, maybe a little dry, but what we're hoping to do today is just make it a little bit easier, a little bit lighthearted, and help you have a few takeaways. So my goals for you today that I hope, if you remember nothing else, these three things. One, we want you to have a good overview of the benefits that we offer. We don't expect you to be able to explain them to every last detail, but at least be able to be conversant in those benefits. Number two, we want to make sure that you know how to find the most up-to-date forms. As you may know, we're governed very heavily by the federal government, and because of such, our forms have to change pretty frequently. So we want to make sure that you have the right forms with the right language on them, know where to find them, and also know how to send those back to us. Number three, we want you to know who to call when you have questions, because we know that questions are going to come. And we've built our agency to handle that and be a resource to you. I'm very proud of our team. I love my SEIB family. And so if you'll indulge me for just a moment, I'd love to introduce you to my work family. So if you work for the SEIB, this is not rehearsed. If you'll please just stand or wave for a second, I want to introduce y'all to the crowd. Okay, you all know Jeremy and Mary Catherine, and Laura's in the back. They're our marketing and communications team. They make sure that they get the information about our agency to you in a fun and creative way, and they do an excellent job. You'll also be hearing from them more today, so y'all can sit. When I call your name, you can sit. We've got our IT team represented here today, Jonathan Little. You're going to hear more from him in a little while about an exciting new opportunity we have to help make enrollment for new employees easier. So we're excited to have you and all the wonderful things you're going to talk to us about today. We have our enrollments team in the back. Hey ladies, these are the ladies that you probably talk to on the phone regularly. Take a moment to go and talk to them today. Put a face with a name and a voice. If you haven't talked to them this week, you're probably going to next week. It'll be a great chance to get to know them. Y'all can sit down. Let's see, who did I miss? We've got our marketing team. We've got Jeannie and Michelle. I know you probably already know them. If you don't, please get to know these ladies. They are your advocates. They are the ones that are going to be an awesome resource for you. Not only will they help answer your every question, they'll point you in the right direction within the SEIB. They're also willing to come and talk to you at your agency. They'll talk to you. They'll talk to your employees. They'll talk to them in groups. They'll talk to them one-on-one. Please use this resource because they want to be able to tell your employees and you about our benefits. I see Mallory in the back. She's part of our wellness team, and Lisa is standing at the Verta table. If you have questions about your benefits, let's say a claim's not being paid appropriately, or you have an employee with a unique health circumstance and they want to know if something's covered. First, call the phone number on the back of your insurance card. Give our vendors a chance to walk you through the process. If that doesn't work, call these ladies. They'll be glad to help walk you through the process. They can help troubleshoot if you come across a unique benefits question. And then also, I've got Tammy Cottingham in the back. I think most of you know her. She plays the wonderful role of supporting us and all of our personnel at the SEIB. We wouldn't survive without you, Tammy. Thank you for all that you do. I won't take much more of your time. I know we've got a fun day filled with learning ahead of us. I just want to leave you with one thought. Our goal is to be accessible to you. If you haven't had a chance to meet all of these people, please take a moment during the breaks to talk with them, get their card, give them your card, get to know them. It'll help make your jobs easier. And you have a survey at the end of the day. Please take a moment in the survey. As Jeremy said, we really do read those, believe it or not, and we'll do our best to be responsive to you. If you have ideas on how we can be better helpful in supporting you in your role, take a moment to write that in on the survey, and we will read them. Thank you all for your time. Thank you for being here today.
Thank you, Sally. So next, we're just going to talk about a few changes that we have for 2023 and a few reminders. So the surveys, as Sally just said, are so very, vitally crucial to us. We have two types of surveys. We do member surveys, which anytime you sign in to MySeed online, any member can access that. And a lot of the changes that we're about to discuss came from that. So it is very crucial to let us know what's important to you, and so we can share that with the board, and that helps them make their decisions of how we should offer benefits to you guys. Also, the conference surveys, like I said, they're very important to us. It helps us improve each and every year, and it gets what you want, like I said. And I'm glad y'all asked for all these refreshments. All right, so for the changes for this year, good news, there is no premium, deductible, or copay changes for active employees. So this is, I believe, 15 years that we have had the same rate. So that is remarkable in the insurance world to keep that the same. So the survivor rate has been tied to the active family rate. So before, I know it was dependent on if it was family or single, or if it was Medicare or non-Medicare. Now it's tied to the active family rate, and so it will be, if you get all of the discounts applied for non-Medicare, you would still do the wellness premium discount and the non-tobacco user discount. That will bring it to $220, and then for Medicare, they're only required to do the non-tobacco user to get the $220. So that will be a welcome change for anyone that is a survivor. Also, the wellness premium discount is going to be combined this year and going forward. So what that means is before, when you would have your wellness screening, and then if you had a referral, you would do the follow-up, that would be $25 a month for that portion of your wellness discount. And then you would, if you had a preventative screening that you needed to get, like a mammogram, a colonoscopy, something like that, that would be an additional $25 discount. Now it's going to be one $50 monthly premium discount, and you have to complete all of the required screenings. So you'll be notified at the beginning of each year what those screenings are. So say you had a mammogram last year, you're not going to be required to do it again this year. So that would be checked off, and so you would most likely just have a screening to do. But you'll just have to make sure every year when you receive that letter, look at it to see if you have anything in addition to the wellness screening to get that $50 monthly premium discount. Also, on the premium cash option and the limited purpose HRA, those maximums have been doubled. So now it's $175, that's going up to $350. So that will be really nice if you have insurance through a spouse or through another employer or something like that. This is a great benefit to take advantage of. Also, the Southland Cancer and Vision standalone policies have enhanced benefits this year, and that's at no change to the premium. So all of these were decisions made by the board based on responses they got back on the member surveys. So they knew these were something that was very important to you, and we wanted to meet those needs and desires for you. So right now on the flexible spending account, we haven't got any update from the IRS so far this year. So at this point, the health care reimbursement is $28.50 with a rollover amount of $570. So healthcare reimbursement, that is for any medical expenses, going to the doctor, going to the pharmacy, anything like that. You can pay it with your flex card. It's pre-tax money, and that's a great savings to you using that. And also the rollover amount. So we just encourage you to use up as much of that money as possible during the year. If you can't use it all up, we will roll forward the $570 for you till the next year, as long as you sign up for the next year of the flex plan, and you'll be able to spend that down in the next year. Dependent care is $5,000. That hasn't changed any time recently. Dependent care, a lot of people get confused and they think this is for their dependents' health care. This is only for child care expenses or adult supervision expenses. That's all that the dependent care is for. It's not for clothing or school supplies or anything like that. It's just if you need a child or an adult parent or someone supervised so you can work, that's where you set aside the money as in the dependent care. If the IRS does increase the maximum, we'll let you guys know at that point. All right. And then just some reminders. This is not new. This changed this year at the beginning of the year. Rick retired, so we redivided the state out into 3 new districts. And so you'll see that Carrie Schlinker is in our North Alabama area. Michelle Dallas is now for the southwest area of Alabama, and Jeannie Blake is for southeast Alabama. Montgomery is divided between Michelle and Jeannie, and you will just have to go to the website to see which agency is assigned to which advisor. There's a simple drop-down box. You just put the name of your agency and it'll tell you which advisor to contact. Just for an example, I was just using ALDOT. I pulled up their map. As you can see, the way they split up the state is very different than the way we split up the state for our advisors. So if you have someone, say, in Tuscaloosa, that regional office is going to be for Greene County and Sumter County and all these counties around Tuscaloosa. As you can see, Tuscaloosa is in Carrie's district, where Sumter and Greene are in Michelle's district. So if you're not 100% sure which advisor to check on the form, please just leave it blank. It's easier for us to figure it out on our end than for you to pre-check it and it be the wrong advisor. Also, speaking of that, our forms do change every year, not only because of advisor changes, but also because of just different benefit changes or federal mandates that come through. We're constantly updating the form. So I know some people, when you get the new form, you print out a stack of 500, just roll them up and use them for fire this winter time. And print out new ones as the people come in. So also, we are to help with some of these issues with the updated forms and also having the new districts that are realigned. We're moving forward with online enrollment. That way it takes all of that decision making out of your hands. You just have to give the code to the new employee and they can sign up, and it automatically puts everything in there for you. So I was going to turn over the presentation to Jonathan Little at this point, and he will explain more about the new online enrollment.
Thank you, Jeremy. Okay, so to start off, we're just going to give you a quick overview of the payroll personnel account setup that we have. The basic benefit that you're going to get from this account is to make your job easier and to make the employees' benefits come through faster. With this, it's processed real time, so you don't have to send the paper in, wait for it to be processed, then the employee gets the information. When the employee or you complete the enrollment for them, it's processed in, and it goes usually same day or next day at the latest. So they'll be able to get their benefits rolling a lot faster. You can also view your supplemental billing. For those that know what that is, occasionally there's some extra things that come out and they didn't get billed in normal billing. That's where you can go in and view it and see what was charged extra, and then if there's any issues, you can send it back in and contact our accounting department and talk to them. So the big one we're going to cover today, though, is the last one, where you create an employee profile. So we wanted to do this, and we created it so you're not doing as much work for the employee to have to sign them up. So you're going to create a basic shell profile for the employee, and then they're going to get to go sign up for their benefits on their own at their leisure. That way, they've got the documents on hand if they're at home, you know, and it's just a little more convenient for them. And if you have any questions on accessing, you can either call our regular help desk, which is the 263-8411 number, or you can contact your benefit advisor, and they'll help walk you through the process. All right, so how do you get access to this account type? Does anybody here already have access to your online account? How many have actually used it within the past 4 or 5 months? Okay. The portal hasn't really changed in probably 6 to 8 months. So those of you who have used it recently, it still looks the same. Most of you will add a new feature to it shortly with the, and the link's kind of hard to see. There's a link on the left-hand side that says new employee enrollment. Sorry, no, that's the next one. It's create new employee. That's where we're going to focus most of our attention today. You can use the other functions where you can submit a change request. So on behalf of the employee, you can see what the employees have as far as their overall benefits if they have a question. So like if they have a question about their discounts and they're coming to you, and you can actually go in there. There's a link for employee search. It will only return people that are within your agency. So you can put their contract number in, pull them up. It'll show their profile information with their discounts. Their coverages will be listed across the bottom. And so you can just give them some general help if they're not able to access it on their own. Again, we're trying to turn this more over to the employee managing their information and empowering you to just kind of show them where it is. So that's the reason for the create new employees piece. And there's a few slides to show you kind of what that manage existing employee, where I told you could search for the employee and it shows their benefits. So upper left-hand corner, you'll see their information, name, address, etc. Down below that, they'll have a section for contacting your advisor. So if you need to contact an advisor specifically, they can click that button, or you can click that button. It'll send an email to your designated advisor, and it'll initiate communication with them without having to do anything else. Same thing with an enrollment specialist. If you need to talk or ask a question to any of the ladies in enrollment, if you click on that link, it sends an email to their group box, and it will be addressed quickly there as well. On the right, there's a little section, and it's much smaller on my screen. Most everybody has a lot larger premium discount section. It will list individually each one of your discounts that you have on your account, whether it be your wellness discount, your non-tobacco discount. It'll have an amount and then whether it's effective or expired. So each one of those will have those 2 designated dates. At the very bottom of the page, that's where the big piece is. That's all of your coverage information. So you're going to have your medical, dental, vision, anything you're enrolled in will be across the bottom. But then there's that last tab where you can enroll for your flexible benefits. So you can enroll for the HCRA or DCRA using the same place. So basically, this main screen is your one-stop shop for everything, if you have an existing employee. All right, so this is the piece we were all waiting to talk about, which is the new employee information setup. To sign up for an account, to be able to access this, there's a payroll authorization form or a account creation form. If you'll create that, you can get it to your benefit advisor, and they'll be able to get it in, and we'll get it processed, and then we'll let you know once the account's created, and we'll show you how to send you information on how to access and everything. You should have received a book, a handout when you got in this morning. That is basically your guide for how to use the new employee registration piece. So that way, if you have any questions, you can refer back to it. We also have electronic copies of those if you need it as well. And you can just contact us. So the new employee setup. Again, I said this is supposed to be easy for you guys, right? So you don't have to fill out quite as much information. The information we require for you to set this up, so you go in and you put in the first name, last name. The security token is automatically generated. Now, I don't know how many of you have gotten phone calls from employees asking what a security token is. This is how you get a security token. For people who are already state employees or former state employees, if they've ever been with the state before, they don't need a security token to sign in. This is only for 100% brand new employees. So these would be the only people you put into the system. Now, one of the benefits of it, if you put in their information on this screen and I find a match in our system already, I'll pop up a notice and tell you, hey, this person already exists, they don't need a security token. They need to log in using their other information because they've already had an account. But the basic information for the new employee continuing is you'll add their social, date of birth, put their employment status in there, their county of employment, that's very important because that ties them to their benefit advisor. Their hire date and their pay frequency. You're done. At that point, you've put in all of the information you need to put in for this employee to create their account and sign up for their insurance. Now, the page, the screenshot on the right, and I think there's a bigger version of it in the booklet that you have. This is the piece you'll print out and give to the employee. This piece is very important. It contains everything they'll need to actually create the account, which will be the last five of their social, their security token, that's the very important part, and the exact match for how you entered it. So their name, first name, last name, when they create the account has to match exactly as you entered it. Same thing with the social and date of birth. If you typoed anything and they didn't notice it, whatever's on the form at that point is what they need to enter. Now, you can't go back and edit. So let's just say you need to go back and make an adjustment. There's a separate piece for a search, and you can put their information in the way it's entered on this printout, pull them up, and then you can update the information to correct it and print it back out if you want to do that. Just so everything's consistent in the paper. But again, this is the main focus of getting you guys involved is you don't have to wait on a delay for other paperwork to come in. As soon as you've got them in front of you, you can put this little skeleton record in, give them their piece of paper, and they go home that night during lunch, whatever. They can start the process and actually sign up for themselves. And then again, if you have any questions, they have any questions, there's also a booklet that we can provide that you can give to the employee that goes with it, that shows them how to continue from that point. So if you want to just, we can get an electronic version of that to you, and whenever you fill it out, if you create the skeleton record, give them that piece of paper, you can hand them a little booklet that says, this is how I sign up and create my account going forward, and if I have any questions, who to contact. And that's just the general overview on that. Does anybody got any questions or anything?
Yes, good morning. It's so cool to see people in person again. It feels like it's been a while, right? And sticking with the, first off, my name's Lenny Stell. I'm with Optum Financial. I'm the relationship executive that works with the state of Alabama and the SEIU group for your benefits, flexible benefits. So I'm going to stick with the digital technical theme, and I want to tell you guys about a new, improved, enhanced microsite that's going live for you guys tomorrow. Am I advancing the slides? Let me find.
Just don't put the mouse in there. Just use the mouse.
Thank you. Easier. I'm looking at it. Oh, this mouse. Sorry, guys, technical issues. What did you, oh, got it. I'll stand back here. I'm bad about that. We'll walk around. So let me forward through, at the risk of technical issues. I've got some PowerPoint slides for you rather than demoing this microsite. However, I am running it at the table over there if you guys have questions and want to see things specifically throughout the day. This is the landing page, myoptumfinancial.com/FEBD is the microsite that is specific to SEIB Group. Because, you know, you guys have 5 different financial benefit accounts. And if you went to optumbank.com, your employees may be a little confused because it doesn't match exactly the type of unique plans that you have with HRAs. So we want to make sure that you have that. You'll notice on this landing page that there's a sign-in button, that blue button. So it's also a great one-stop shop for folks to actually log into their account once they've set up their credentials. There's a toolbar across the top that's in that sky blue. So that's a great way to navigate the site. But for the benefit of these slides, I'm going to show you what it looks like if you scroll down, because that's another way to get to it. You'll see 5 tiles with the 5 different types of plans that are offered, both the HECRA, the DECRA, the premium cash option, the limited purpose HRA, and the retiree HRA. By clicking the Learn More button, folks will see some greater detail about those different types of plans. If you scroll down some more on that page, it gives instructions. You guys have a printout of this? I hear the paper. Okay, cool. So you got this to go with you. Feel free to take some notes. The Health Safe ID is where someone starts. They create a Health Safe ID, that's the username and password, to access their own account, and it's universal for any Optum or United Healthcare logins, that Health Safe ID. So that gives some information about how to do that. Then there's some other tiles in the resources. One is an eligible expense tool that someone could access if they wanted to research specific examples. There's also Optum RX tile on here that's been inserted for your benefit since Optum RX is one of your benefit programs. So you can get to it from the Optum RX website just like you do today, or this is another way to get there. And then there's the Optum Financial mobile app, which hands down, I didn't even carry it up here with me, most of us do all of our banking and account management via our mobile devices. Nothing's different with these either. It's the greatest, easiest 24/7 access to your account. You can do all the same things on the mobile app that you can at the computer. And then contact information for Optum Financial is right here. This is a 24-hour-day, 7-day-a-week, 800 number that is specific for SEIB. This is, if someone Googled Optum, you wouldn't find this 800 number. But this one will lead to someone that has firsthand knowledge of your plans and programs. And of course, if someone prefers to converse with us via email, there is an email address there also. Now going back to the top of that landing page, you could do all the same things we just looked at by going across the toolbar on the top. And I've just highlighted, for instance, that tax advantaged account piece on the toolbar. That's the little window that would come up if you hover over that. Each of the plan types is shown. And if you clicked on one of those plan types, it would get you to the same information that we would have seen if we had clicked on one of those tiles with the plan types by scrolling down. You also see customer support there. That would take you to that page that showed Optum Financial's contact information. The resources page would show you that eligible expense tool. And then the Claim Resource Center. Let's drill down a little bit on that. The Claim Resource Center, this is really going to serve as that one-stop shop for anything claim information. When someone goes into this center, they'll see the different plan types. They'll see a description of what the plan is, what type of expenses are eligible to be reimbursed for those plans. With the Hecker account, someone's got the payment card, but with all the others, it's a reimbursement account. So that's what this site helps with, is to help someone figure out, how do I get reimbursed for this expense that I made? There's videos, there's flyers, there's claim forms. All of the information needed is there in the Claim Resource Center.
Good morning. Can you hear me? Good morning, everyone. My name is Michelle Alvarez, and I am with United Healthcare. I would say today's your lucky day. You get 2 Michelles in one day, huh? So I am here to talk about the extra benefits and programs that are included in the State Employees Insurance Board plan for those retirees that are over 65. And this is a Medicare Advantage plan with pharmacy. So United Healthcare has the largest network, national network. This is a PPO. There's no referrals needed. It's national. They can go anywhere they want. They could go in and out of network. The provider does not have to be contracted with United Healthcare. The provider just needs to accept Medicare. That's it. And just a little, I guess, tap on the shoulder for United Healthcare. So we were a 5-star Medicare Advantage plan for this year, for 2022. And we have been awarded 5 stars again for 2023. So let's talk about original Medicare initially. So when someone reaches 65, they're eligible for Medicare. So they're eligible because they've reached 65 or they qualify on the basis of disability, and they're a U.S. citizen who's resided in the United States for at least 5 consecutive years. If the retiree or their spouse have contributed to payroll taxes to Medicare throughout their working life, they're eligible for Medicare regardless of their income and health status. So there's no pre-existing for Medicare. So step 1, when anyone turns 65, they enroll in Part A and they enroll in Part B. In order to be in a Medicare Advantage plan, the retiree does have to enroll in Part B. So step 2, if you're a retiree or anyone that's retiring, will decide, so which way do I want to go? Do I want to go option 1, which would be they would have the original Medicare, so A and B, and they add a supplemental plan, and then they add Part D. So that's a lot of paperwork, a lot of claims, a little bit complicated. So the best option really is to go into a Medicare Advantage plan, where that insurance carrier handles all of the claims, supplies the network, does all the benefits. It's so much easier for a retiree. And that is what the state employees, retirees, have benefits for. It's a Medicare Advantage plan, which includes the Part A, the Part B, and Part D. So Medicare Advantage plan is C. So ABD equals C for Medicare. All right, so just to break down a little more, what does A cover? A covers the hospitals, basically. Skilled nursing facilities and home health. Part B covers the doctors, the outpatients, the screenings, the lab tests. And then you have the prescription drug coverage. And then we also, as a Medicare Advantage plan, we offer many programs that are included in the Medicare Advantage that you may not have access to it as a commercial or active employee. When you become retired, you get a little more extra programs and benefits. Again, the retirees can visit any doctors, any specialists, no referrals. It's a national network. They do not need to reside in Alabama. If they want to move to New York, California, they have access to all the providers everywhere in the United States. I get a question for international traveling. It's just like when they were active, it's covered for emergencies if they go international traveling. Emergency and urgent. So emergency, heart attack, urgent, your broken arm, that's covered. So we're going to go into the benefits of the Medicare Advantage plan. The annual deductible is $0. They do have an annual out-of-pocket maximum of $6,700. And the annual out-of-pocket maximum is all of the co-pays they would have to pay goes and accumulates to that amount. Here are the benefits, and I know it's a little difficult to read, but I will show you where you could look up a little more of the information. I also gave you a bag if you came by the table. If not, come and see me. But really quickly, the PCP copay is $10. And it's also $10 if they go out of network. So if they didn't go to a provider that's contracted with UHC, but they saw a provider that does take Medicare, they're still going to pay that same copay. There is no difference for in and out of network, okay? Specialist is $15, urgent care is $24, emergency room at $80, inpatient hospitalization is $0 copay per stay, outpatient surgery it's $150, and they do have virtual visits. And virtual visits are with Amwell, Doctors on Demand, and Teladoc. They do have preventive services included, and that's their annual physical, their annual wellness, immunizations, breast cancer screening, colon cancer screenings. Retirees do get incentivized on getting their annual wellness visit. So we will send them a gift card for doing that. And they could have their annual wellness visit along with their annual physical at the same time. So some additional benefits that are covered, podiatry is covered at a $15 copay, Medicare covered for chiropractic at $15, routine hearing services if it's for hearing aids, because they do have a $500 allowance towards hearing aids, it's a $0 copay, and they do have routine vision exams included. There's a Medicare one and then there's a regular one, and that's a $15 copay. Now, very important, if a retiree were to go outside of the state plan offering, and they get an individual plan, many of you have probably heard about a donut hole, right? So the retiree, or that individual Medicare, they're paying for their prescription, they get to a certain amount, and then their out-of-pocket increases. That's what that's called, the donut hole. In this plan, in the Medicare Advantage plan for the state retirees, there is none of that. There is no coverage gap. They continue paying the same copay until they meet the catastrophic amount of $7,400. Then the plan pays 100% of their prescriptions after that. Obviously, someone has to take a lot of prescriptions in order to get to that amount. But there is no gap in coverage. So they know what copay they will be paying for their prescriptions, which is very beneficial. Now the copays for prescriptions, for tier 1, which is the preferred generic, it's $3 for 30 days and $8 for 90 days. For the preferred brand, it's $23 for both 30 and 90. Non-preferred, which is tier 3, it's $53, and then the tier 4, which is a specialty, which is unique or high-cost brand name drugs, at $53. Common vaccines are covered under the plan. So influenza, pneumococcal, hepatitis, the COVID-19 vaccines are covered at no cost. And then we also have the Part D, which is the shingles, the tetanus, the hepatitis, and hepatitis B for those at low risk. Diabetes testing and monitoring supplies are at a $0 copay. We do have our coverage of the One Touch and Accu-Check blood glucose testing strips and meters that we offer the retirees, so that's important to them. As mentioned, we do have the annual physical and annual wellness visit that we do incentivize again for the annual wellness visit. They can do both of them at the same time of their visit, and they do not have to wait the 12 months to get it. So let's say they got their physical and their annual wellness visit in July, and they go back to their doctor in January. Doctor wants to do their physical and annual wellness, they could do it. They do not have to wait the 12 months to do that. We do have house calls. So this is when a registered nurse would go into your house, into the retiree's house, ask them questions, go over their medications, do a summary of their visit that the retiree could take back to their doctors on any findings they may have had, or just so that, you know, their records match our in-home visit. We also incentivize the retirees for having these house calls, for having these in-home visits. So they are incentivized in doing so. We also have the Renew Rewards program, which is where we incentivize the retirees. We also provide them with brain games, recipes, workout videos, learning courses, interactive quizzes, and all this is online. We also have the Renew Active. So Renew Active is our gym membership or Medicare fitness program. Many of you are familiar with Silver Sneakers. Well, our program is called Renew Active. We have as many, or if not more, gyms than Silver Sneakers, and we have premier gyms. So premier gyms are the Orange Theories, the Cycle Bar, Lifetime Fitness. So we have those premier gyms that are included in Renew Active. The retiree just needs a code if they're new to the plan, take it to their gym, and that is it. They could visit that gym free at no cost for them. We also have videos on demand they could do. They could schedule a workout online. So it's very easy for them, and it's very important for the retirees. This is very important to them. They also could get care virtually. So many of us are used to maybe doing some virtual visits. We're sick, we have a sore throat, we get our phones, we do FaceTime with a provider. They have that also included. Mental and behavioral health, that's important to everyone. So we have therapy programs included that are with Able2. We have ongoing mental health support with Optum and health and wellness resources with Renew. Oops, sorry. They also have access to the 27 nurse support. So on the back of their ID card, it'll say nurse line or nurse support. They could call at whatever time of the day or night. They're not feeling well, just not sure if they could need to go to the emergency room, or they could actually wait, so they could speak to the nurse and have that consultation at no cost. We have the United Healthcare Hearing, which is a $500 allowance they get towards hearing aids every 3 years. We have the United Healthcare Hearing, which has over 7,000 hearing providers, and they handle all of the process for the retirees. United Healthcare Hearing, they could have an in-home fitting for their hearing aids, or they could go to their doctor. It's very convenient for the retirees. Healthy at Home. So when there's a retiree that is discharged from the hospital or a skilled nursing facility, they will be eligible to receive 28 home-delivered meals. And these meals are specific to their diet. So if they're diabetic, they're going to get meals that are diabetic friendly. So these are, they're eligible for that. They're also eligible for 12 one-way rides to any medical related appointments. So if they have to go pick up their prescription, they can pick it up. So that's 12 one-way or 6 two-ways. So we won't just leave them there, we gotta bring them home. They also get 6 hours in-home personal care provided through CareLinks if they need some assistance with preparing meals or bathing or medication reminders. They do get that included. Now we have a new program that's going to be new for 2023, and I've done a lot of retiree meetings, and this is something they are very excited for. And this is the Personal Emergency Response System. It's provided by Lifeline. And what it is, it detects falls. So they could wear a pendant on their necklace, or they can wear a bracelet, and it will detect if they fall. They just need to live in a Wi-Fi, AT&T Wi-Fi area. It's not connected to their cell phones at all. It just has to be in the cloud somewhere. I think we're also going to include Verizon, or they have a landline. So there's 6 different packages of devices depending on the retiree situation that will fit that retiree that gets shipped to them at no cost. So all of the retirees that are on the Medicare Advantage plan for United Healthcare will be eligible to receive this. They have to ask for it. It's at no cost, and there is no monthly service cost for this item either. It's waterproof, so they can go into the pool, because a lot of them like to swim a lot. They can go swimming, and they can just wear their pendant or their bracelet. It doesn't get ruined. So this is a great new benefit and program that we are including, and it's been very well received. We have the Rally Coach program. So Real Appeal is a weight loss program. They do get a kit, a Real Appeal kit that's included, and that could be exercise bands, that could be a scale for the food. It'll be videos, recipes to help them lose weight. They also get a wellness coach included. They have visits with their wellness coach to make sure they're on track and losing weight. We also have the Real Appeal Diabetes program, pre-diabetic program. So any of those that are on the verge of becoming diabetic, they could join the Real Appeal pre-diabetic program. And it is CDC certified program. We also have, for any of those that would like to stop smoking, which is the Quit for Life, which is a tobacco cessation program. All of these programs included at no cost for the retirees. We also have a discount program, and they can go to this website. They want to travel, they want to buy something, whatever they want to do, they can find a discount on this site.
Good morning, everybody. Good morning. I am Michelle Dallas. I am the Benefits Advisor for Southwest Alabama, and we are so excited that you all are here back for our in-person conference. I'm a tad bit excited too because this is my very first in-person conference. So what I'm going to be covering with you all today is going to be our SEIB health coverage. As you can see, the state insurance health insurance plan we call CHIP. CHIP is administered through Blue Cross Blue Shield, and at least 95% of our state employees have this coverage. Our pharmacy benefits are administered through Optum Rx. We do have 4 free plans. We have our supplemental plan that is administered through Blue Cross Blue Shield. We have our premium cash option, which is administered through Optum Financial. Our limited purpose HRA is administered through Optum Financial, and we have our optional plan that is administered through Southland. No, members are only eligible to enroll in 1 plan per year. I know a lot of people get excited, especially when it's a free plan. Can I have 2? I'm sorry. You can only have 1 and be enrolled in 1 plan. Maybe one day, just not now. Now, our state employees' health insurance, again, CHIP, medical coverage with our prescription benefits. Our costs to you are monthly premiums, our co-pays, co-insurance, and deductibles. We do have discounts that are available. We have a spousal surcharge waiver for those that have insurance for spouses that actually have. There are ways in order for you to have that, meaning you have a self-employed spouse, spouse is unemployed, or your spouse has insurance premiums with another employer, however, they are just a little bit higher than the norm. We have our wellness premium discount, and we have our tobacco premium discount. If you want to know more about the discounts that we have, you can check our website at www.alseib.org. So let's get into our discounts and our waivers. The form that you see on the screen right now is our non-tobacco user discount. This is our form IB05, and you can also find it on our website. And also, if you don't want to find it on the website, contact me, contact Jeannie, we can email it to you real quick. But this form is for our non-tobacco discount. You must be tobacco-free for 12 months. And this discount is $60 for you, and it is also $60 for our member's spouse per month. You can apply for this discount online at myalscib.org, or once again, complete the form and turn it in to us. Our wellness discount, this is form IB13, and it can also be found on the website at our www.alscib.org website. Remember, wellness screenings have to be completed by October the 31st. And if you go and have your wellness screening and you have a referral, make sure that you have that referral and you have followed up with your doctor prior to October 31st. Now, if you missed the deadline, just have everything completed. You can still turn it in. Just note that your discount won't be in effective January. Our wellness premium discount, no form, claims-based, resolve all of your preventive screenings that are needed. If you want to see this, you can log into my SCIB account, or you can call your wellness center, call the wellness discount verification line, and they can verify the discounts for you. Once again, this will go to $50 next year. Right now, it is still $25. The spousal surcharge waiver has a $50 discount. This form that you see, if you have a spouse that is self-employed and does not offer themselves group health insurance, they are unemployed, or they actually have a job, but the premiums for individual coverage is $255 or more, or your spouse has a job, but that job does not offer health insurance, you will need to complete this form. I do qualify for this particular discount because my spouse is self-employed and he does not offer himself other group health insurance. So keep that in mind. A lot of people tend to forget about this discount. So just make sure if you fall into this category and you have been missing this discount for the past couple of years, complete this form and get it sent in to us. The next form that you see is our FPL premium discount. This is form IB12, and it is also located on our website. Note, this particular form is going to be based on household income, and it's also going to be based on your tax transcripts in order to get this discount. Now, I get it. This here is personal information. This is not anything that the members have to send to the payroll clerks. They can send this information directly to the accounting department. But they have to complete this form and also turn in their federal tax transcript form, their federal tax information along with that form. If they don't complete those steps and send that in, it will be noted that it is incomplete. You will get a letter in the mail. But once again, if you feel that you qualify for this, complete the form, send in your information. You never know. The discount ranges between 10 and 50%. Our discounts and waivers, all discounts and waivers are prospective and can be earned on the first day of the second month after SCIB receives the missing information that you, that is if you have missed the deadline. Refunds are not given because you missed your deadline. So take note, If you don't have your wellness screening completed by October 31st, but you get it in by November, remember, January, we don't give back the fee. No, again, it is very important that we all know that refunds are not given back failure to submit your information in a timely manner. Our preventive and our wellness screenings, everybody is aware that the deadline for that is October 31st. So therefore, we give everybody enough time, but I get it, some people wait to the last minute to have it done. But just make sure everybody is aware that refunds are not given just because you missed the deadline. You can visit our website, which is at www.alscib.org, or you can complete your MySeeb account. And completing the MySeeb account is a very great tool because at that point you can pull up on your online and look at whatever you need to look at your leisure. The wellness premium discount and the discount verification line, that number is 334-263-8454. Toll free, the number is 866-841-9489. The CHIP premiums. As you can see, the first number that you see on this slide is what insurance costs prior to any discounts. Well, single coverage prior to discounts is $140. But if you've submitted your non-tobacco discount form, that's a $60 discount. And your premium discounts, which is your wellness and your preventive screening, that's $50. So the insurance for single can be as low as $30. For family without a spouse, $330 is the number prior to any discounts. However, as long as you submit your non-tobacco form, $60 discount, your wellness premium discount of $50, your insurance is as low as $220. With family with a spouse, prior to any discounts, this cost is $490. Well, there is your discounts again. $60 non-tobacco discount for you, $60 non-tobacco discount for spouse, so that is $120. Then your premium wellness discount for you and spouse, as long as everything has been completed, that is $100. The spouse's surcharge waiver, if you have a spouse that, as I said earlier, and you qualify for that discount, that is $50. So your insurance can be as low as $220. And this is for our medical coverage. We do have our standalone policies. Our standalone policies are our dental, our vision, our cancer. Now, our dental is the only standalone policy we have where you have two options. You have the option for Blue Cross Blue Shield or Southland. Our vision is through Southland, and our cancer policy is through Southland. And this form, I don't know if you all can really see the form, but we will have it available so you can see it. I'm not sure, can you all see this? Okay. Now, the other standalone policies that we have, our cancer policy. With a cancer policy, no pre-existing condition limitations. It's going to pay regardless to whatever other coverage that you have. It is $12 for single, and it is $24 per month for family. If anyone has the cancer policy now, effective into 2023, the benefits are actually better. So if you are considering having a cancer policy, make sure you look at the new increase in what it is going to cover. It actually went better, and it is a great policy to have. Our vision policy is going to provide either contacts or lenses and frames, but not both in any year. Also, you have the $150 per eye benefit for refractive surgery. The cost is $12 for single coverage, $24 for family coverage. Our vision policy, effective 2023. The benefits have increased in that plan. So if you have not had the vision plan because you thought it may not have covered enough or the cost was not what you had was not, efficient to what you would pay all year, it has gotten so much better. And 2023, you can see a big difference in our vision plan. Again, it is worth having. We have another standalone policy, which is our TRICARE supplement. This is for our members that have TRICARE. It is a voluntary insurance supplement, and it helps with out-of-pocket health care expenses. It works best with TRICARE Prime, Select, and our Retired Reserve. Now, it does have a cost, $60.50 for single, $119.50 for children only or spouse only, and it's $160.50 for family coverage. And remember, the policy can be signed up for any time of the year and will be effective the first day of the next month.
The TRICARE supplement, does that also cover CHAMP VA? Or is it only TRICARE?
That's TRICARE only, am I correct? CHAMP VA, can they sign up for CHAMP VA with TRICARE supplement?
As far as I know, yes.
Can?
Yes, I think so. We'll double check.
Now, the supplemental plan. The supplemental plan is one of our free plans. In order to have a free plan with the state of Alabama, you have to have other group health insurance. That other group health insurance is through a spouse, through another job. If you are under the age of 26, through your parent. Now, the supplemental plan, what it does, it eliminates most co-pays, co-insurance, and deductibles when your primary insurance does not cover 100%. Now, primary insurance deductible must be less than $1,400 per year for single and $2,800 for family coverage. This excludes plans such as Medicare, PHIP, TRICARE, TRICARE for Life. This plan does not work, with these government plans. So if you have a member that would like to enroll in our supplemental plan, they need to complete the enrollment form, and they also need to turn in a copy of the summary of benefits for the other insurance. A lot of times, enrollments receives the enrollment form and that summary of benefits is missing. That summary of benefits is that page that we all get when we start a job, but we kind of toss it to the side because we don't have to sign it. But what it is, it's going to tell you what your co-pays are, what your hospital stays are. That is where this $1,400 per year and this $2,800 comes in at, because that is what we are looking for when we get ready to enroll you in that supplemental plan. Because if you exceed that, you cannot enroll in our supplemental plan. But fret not, there are other free plans that we have. We have our premium cash option. The premium cash option has been $175 per month reimbursement, and the best thing is that is now increasing effective January to $350. Now, you have to set up your account with Optum Financial. This way you can view your account, and you can also submit your information showing, well, hey, this is what I paid with my other group health insurance. So that way you can get your reimbursement. The way you get your reimbursement back, once you submit that information, they will give that to you. You're going to have an option in the form of a check, or those funds can be automatically deposited into your checking or your savings account. We have our limited purpose HRA. This is, once again, free plan. It is for our members that have other group health insurance. This is also reimburses up to $350 per month tax-free. The difference with this one and our PCO is this one only works towards dental and vision expenses. Once again, in order to see how much you have accumulated or how to set up where you can show, hey, I have to submit my claim, all you have to do is set up your account with www.optumfinancial.com/financial. Once again, in order to get the reimbursement back, once you have submitted that information, you are going to be asked if you want that back in the form of a check, or if you want those funds automatically deposited into your checking or your savings account. Our optional plan, which is another free plan, it has 4 benefits in one. It has a dental policy, a vision, a cancer, and a hospital indemnity. It coordinates with other dental and vision coverage. The cancer and hospital indemnity is going to pay regardless of the coverage. Also note, with this particular plan, you must be enrolled for 12 months. You can't enroll and 3 months down the road decide, I don't want to do that. You have to be enrolled in this particular plan for 12 months.
Bear with me on some of this, particularly as it relates to the legal updates, and hopefully Lori will be back with y'all next year. So what is new this year with state personnel? We have had a number of changes since January 2022. I'm going to kind of give you a high-level overview of those today, talking about 3 specific things. We have made revisions to our state pay plan. We have made revisions to some of our state personnel board rules. And then we have made revisions to our state personnel procedures, specifically as they relate to our bonuses. So I'll be going over each of those just very briefly today. Okay, starting with the pay plan, which I was most excited about. Hopefully you all feel the same. This was the Darby Forrester Pay Plan Amendment. This was approved by our state personnel board in their June 15th meeting this year with an effective date of July the 1st. What this did is it added 4 steps to the maximum of each of our semi-monthly pay ranges. So I'm sure you all know that each step in our pay ranges increases by approximately 2.5%. So with the addition of those 4 steps, we increased our pay ranges by approximately 10%. There were a number of factors that led to this expansion, beginning in 2020 and then sort of continuing throughout our post-COVID world. Our division received a record number of salary survey requests. So in an effort to sort of stop piecemealing these one at a time and to take a more comprehensive approach, we decided to look at our pay plan in its entirety. Specifically as it relates to range width and movement through the structure. What we found was that our range widths, that from the minimum to the maximum of our ranges, was below that seen in many other states. Looking into that a little more closely, we found that we had approximately 7,500 employees who were at the maximum of their assigned pay ranges, what we call topped out. So that would be out of a workforce of around 28,000. So that means approximately 27% of our workforce was topped out. Diving a little bit deeper into that, we found that our overall workforce had decreased by around 1,500 employees over the last 2 years, and we had turnover rates exceeding 17%. So sort of taking all of that into consideration, we made the proposal to add the 4 additional steps, which as you know was approved, and wound up increasing our range widths to around 58.5% from the minimum to the maximum, which brought us much more in line with the rest of the nation. There were some, sort of stipulations that went along with this pay plan expansion, conditions that govern the implementation. Employees who are currently at the maximum of their assigned pay ranges, they had to retain their existing annual raise date and were not eligible for an annual raise until that date. So that we didn't add everybody to an annual raise list all at one time. 7,500 employees, as you can imagine, added to a raise list at one time could be a little problematic. Normal schools for salary progression did still apply, meaning that no employee could receive all 4 steps at one time. Employees were still limited to a maximum of 2 steps per appraisal. And then unclassified employees had to follow the same rules as our classified employees, meaning they were also limited to 2 steps and then only once per year. Okay? So that sort of, again, is a high-level overview of our pay plan expansion. We also made several changes to our board rules this year. I'm going to talk about 2 of those. One of them is related to retired employees. Effective June 13th of this year, a rule change was implemented that allowed an employee who had retired from state service to return to service without a waiting period. So basically, this means that employees who have retired can come back as a retired state employee in a much timelier manner. Prior to this change, individuals who had separated from state service had to remain off payroll for an amount of time equal to the amount of annual leave they were paid out. So this is the second time that that particular provision has been suspended. It was temporarily suspended in 2020 during the height of COVID, and now it's suspended again through March the 31st of 2023. And as a side note, employees do still have to remain off the payroll for 30 days as an RSA requirement. We also made changes to our board rules related to donated leave. That went into effect very recently, October 15th of this year, and it deals with donated leave for the purposes of adoption. So again, this expands the qualifying reasons for which an employee can receive donated leave to include adoption. Employees may now receive up to 2 weeks per adoption. This leave cannot be taken intermittently, and it cannot be taken until the adoption has been finalized by the courts. Okay, and that's sort of the overview of the changes we've made to our board rules. And then lastly, I'm going to discuss some changes we've made to our state personnel procedures, specifically as they relate to our bonuses. So I'm sure most of y'all know the state has 3 types of bonuses. We have special merit bonuses, incentive bonuses, and retention bonuses. The changes that we've made this year have modified the amount of money you can receive for these bonuses and the frequency with which you can receive these bonuses. We have also changed our rules to allow employees to receive more than one type of bonus, whereas in the past that was prohibited. And these are not changes, but I do think they bear repeating just to remember that bonuses are lump sum payments that are not used in the calculation of retirement or related benefits, and they do not alter the annual raise date of employees. So talking just very quickly about each of those 3 types of bonuses. Our special merit bonuses, as you know, those are, an agency may recommend a special merit bonus to employees with permanent status who have performed exceptional acts outside of their normal duties and responsibilities. The most in the past that an employee could receive for one of these types of bonuses was $2,500 within a 24-month period. We have increased that to $5,000 within a 12-month period. Another change that we've made for this type of bonus is now the State Personnel Board has delegated to our State Personnel Director the authority to approve bonuses of $2,500 or less, meaning that instead of going before our State Personnel Board at its monthly meeting, if the special merit bonus request is for $2,500 or less, it can be presented to our State Personnel Director for her approval. Bonuses in excess of $2,500, not to exceed $5,000, do still have to go before our State Personnel Board for its approval. Moving on to retention bonuses, that is exactly what it sounds like. A retention bonus is a bonus that can be awarded to an essential or critical employee who has a bona fide offer of employment outside of state government. So we're not talking about one agency to another, it is outside of state government. In the past, we have allowed for retention bonuses to be awarded of up to $5,000 in a 24-month period to an employee who meets these conditions. This has increased to $10,000 in a 24-month period. This bonus does still require finance director approval. That's nothing new, that has always been in effect. And employees do have to sign an agreement with the agency that they will remain employed for 1 to 2 years if they are awarded this type of bonus. And then lastly, incentive bonuses. An agency may award employees with permanent status an incentive bonus based upon established criteria approved by state personnel. So basically, incentive bonuses are bonuses which are awarded when employees meet predefined criteria that promote efficiency and productivity. Previously, these bonuses were capped at $2,500 in a 12-month period. We have increased this to $3,000 in a 12-month period. And then again, these type of bonuses may still be awarded annually, biannually, or quarterly. And so those are our major changes to the bonuses. And that is sort of, again, just a very high-level overview of changes we've made to our pay plan, our board rules, and our state personnel bonus procedures. In closing, I would like to note, too, that, as I'm sure you're all well aware, our state legislature this year passed a 4% COLA for state employees. So taking into consideration the approximately 10% increase our pay ranges saw with the pay plan amendment and the 4% increase from the COLA, our pay ranges have seen an overall increase this year of around 14%, which is pretty exciting. In addition to the pay range changes and the changes to the bonuses and our board rule changes, we hope that these will all sort of work together to help with recruitment issues that we've all been experiencing the past couple of years, and also help with our retention issues. I'll be happy to take any questions.
Probably won't try to hold you all too long. My name is Jaleesa Grissom. I'm with Empower Retirement. To you all, it's Alabama Retire. It's your deferred comp plan or your retirement savings plan for the state. All right, Empower is the second largest retirement services company in the U.S. You all's contract is also called Alabama Retire once again. I am one of 4 advisors for Empower. If you want to take out your cell phone, I know a lot of y'all stopped by and got my card, but we are actually divided up by county. So I service the central to southeast part of the state. This is my county right here in the purple. Just depending on where you all are located, I know a lot of people traveled in today. You will have a different advisor. But you can feel free to still reach out to me, and I can kind of put you in the right direction as to which advisor that you would speak with. All right, so retirement looks differently for everyone. Our job as advisors is to kind of help you devise a plan so that you don't have a gap in income once you retire and no longer are able to work and contribute to your everyday lifestyle. So we want to go ahead and start your planning as early as possible so that you'll have the income that you desire in retirement, so that you don't have to change your lifestyle pretty much. You all are offered 2 deferred comp plans. The state personnel board contracted us in to kind of help guide and help you all plan for retirement, because sadly state and governmental employees are the least prepared for retirement, and it's largely because of the overdependence of the pension plan. So we kind of come in and supplement the income for you, okay? The easiest way to enroll is to go to alabamaretire.com. Everything is done online. If you don't like to do it online, just contact us and we can send you a quick enrollment form. You'll go to the register now button, and it's going to ask you for 4 simple inputs: your social, last name, date of birth, and your zip code. Make sure you go ahead and designate your beneficiary as soon as you register, because we don't like to leave that unturned, okay? All right, make sure that you also provide an email address so that if you do separate service, we can still contact you so that you can have access to your account. All right, there are several benefits for this plan, so I'm going to get into a little bit of that today. And this is one of the easiest ways to save for your future. This is payroll deducted, so it comes straight from your check before you even see it. and you get to decide which ways that you want to be taxed on this account. All right, the IRS limit for 2022 is $20,500 for individuals under the age of 50. Once you reach 50, you get the special catch-up provision of $6,500. So that gives you a total of $27,000 you can contribute to your 457 plan. If you're within 3 years of retirement, you can contribute up to $41,000 into this plan. There are special forms that need to be filled out for that, but that is available for you. All right, potential tax advantages. You get to decide with this plan how you want to contribute your money. You can either contribute it before taxes or after taxes. If you choose to contribute on a pre-tax basis, it can help lower your taxable income. Like I said, you can contribute up to $20,500, so that can potentially lower you significantly. If you're over the age of 50, you get that extra special, that additional special catch-up. All right. And so, like I said, it's a personal preference. Do you want to go ahead and take care of your tax obligation up front? The plus side of that is any growth is tax deferred. You get to take home your extra pay. This is the pre-tax basis, and you may lower your taxable income later. On the other side of that, you can choose to contribute Roth. That's after taxes. So you go ahead and take care of your tax obligation up front, so that when you retire, that tax obligation is already taken care of. All right. So I won't go into and give you all economic lessons today, but just understand the beauty of compounded interest. The earlier that you are able to contribute, the more your money is able to grow and work for you. Okay. Now, we do allow for any outside qualified money to be rolled into this plan. That includes the old 401k, 401a, 403b, another 457 plan. As long as the money is qualified, it can be rolled into this account in case you all work, with the private sector previously. All right. So investing in your retirement accounts. We have 3 different types of investors. You can choose to do it yourself, you can choose for us to help you do it, or you can choose for us to do it for you. So you just have to decide how much you want to be involved in the investing part of your profile, and then we can kind of guide you along and help you with it as well. All right, so these are some terms that you need to be familiar with if you decide that you want to be your own advisor, do your own investments. I won't go down the long list, but these are just some terms that you do need to be aware of if you're going to be doing your own investments, okay? Also be aware of how mutual funds work. The different stock funds, the classification, the purpose of a stock fund, and the associated risk, which we're all seeing right now, the market volatility. The overview of the bond funds as well as the stock funds. So you need to know the purpose of the bond fund, the maturity, the credit quality, and the associated risk, and also about cash alternatives. So if all of that went over your head, you may want to consider us managing your account for you. That is an option for you. The managed account services that we provide for you is called My Total Retirement. It gives a more personalized approach to your investment. So you will sit down with an advisor, and we will ask you a series of questions, including what other investments that you have in your outside accounts, when you want to retire, how many years that you'll have with the state. Once you retire, we take all of that in consideration, whether you'll be a Tier 1 or Tier 2 employee, and then we'll help devise a plan for you, okay? It's very simple, it's comprehensive. Like I said, everybody's retirement plan looks differently, so we're here to kind of help personalize that for you. And it gives you one-on-one access to the investment advisor representatives. And all of us, as investment advisor representatives, are required to be duly licensed as registered representatives and investment advisor representatives We are salaried, so talking to us does not cost you a dime. We don't receive commission, but we're just simply here to help you devise a plan for your retirement so that it's not too late and you're not, wanting to see, what you want to do once you retire. All right? Very simple to receive online advice. Again, go to alabamaretire.com. You can look at all the different investment options that we do offer for you. And then you also have access to contact us. If you choose not to do the personalized My Total Retirement account and you don't want to do it yourself, this is the Help Me Do It option. This is a target date investment. It chooses one mutual fund based solely on your age. A person that's age 35 will probably start off a little bit more aggressive, and as time goes on, the mutual fund changes for you. So you pretty much kind of set your investment and forget it. So you may start off more aggressive as time goes on. You'll become more conservative, and it'll be more allocated for when you decide to retire. All right. Get help along the way. Take advantage of your Alabama Retirement Plan advisors. We're solely here to help you. I'm going to put that screen up again in case you all didn't screenshot it. I'm trying to make sure I did not forget anything. This plan does offer in-service loan, the in-service loan option, so that is available for you all who are participating in this 457 plan. And then you do not have to take your distributions once you retire or separate service from us. The only time that you are required to take a distribution is at age 72, and that's an IRS limit. So you can leave it in and we can continue to manage it for you even after you separate service or retire. All right, are there any questions? Yes, ma'am.
Are there any fees involved?
There are fees involved with the My Total Retirement account, and if you want to go to alabamaretire.com, once you select the investment option, it'll give you a list of everything that you need to know as far as fees is concerned.
And a break. So, I'd like to offer you a couple of axioms for life that I have found useful. One is the definition of success. My definition is this: if you've tried something really hard and with all your might and perhaps failed, you're better off than those who try nothing and think they are succeeding. Right? Think about that. And that's followed up by a related axiom of go out on a limb. Because that's where the fruit is, right? Yeah. Take that calculated risk. Calculated risk. I'm not talking about a careless risk, okay? Calculated risk. So, one of the main things that we do is advocacy, especially in the Alabama legislature. And it's probably shocking to you to realize this, but they do not start every day in the Alabama legislature by saying, Mr. Speaker, what can we do for our state and local retirees? They don't do that. I know. I spent 2 terms there. So they don't do that. You have to have an advocate. You have to have somebody working for you. Do you call them lobbyists? Okay, I know that's a bad word for some people, but guess who was the first lobbyist? Guess who was the first lobbyist? Come on. It was Moses. Yeah. Moses was the first lobbyist. Okay. So we're there. We're your eyes and ears in Montgomery. Last year, there were just under 100 bills that affected retirement benefits, leave, insurance, sick leave, all kind of issues. And only about 6 of them were any good, okay? Sometimes my former colleagues say, I've got an idea. You know, and they file these bills and we read them and look at them and go, you might want to tweak this. And Sally, you know what I'm talking about. Or, this is just a bad idea. We want you to withdraw that. So we do that as well. But it's a great organization. We are now pushing back up towards 17,000 members, and COVID hit us very hard. We got down to about 15,500 members. We couldn't have meetings, but now that's what we're doing all over the state is meetings. Great programs, great network. We have 124 HR personnel people that are members. We sort of have our own group. And what we also do is an arbiter of information. We have our weekly update that we're putting out on all kind of different issues, benefit changes, everything. We have 54 chapters around the state, 20 districts, and I've come to just about every one of them. And then this summer, we had our bonus meeting. One of the biggest things that we did is this last year in the legislative session was pass our bonus bill, which gave a bonus to state and local retirees. We worked on that a year and a half. We probably could have got it passed the year before. We had a couple of state senators who wanted to get cute with our bill. So, and they stalled it last year. So last fall, we gathered up a lot of our members in both of their districts, and we went with them and had a prayer meeting with them. And got them to change their mind. Because guess what? 22 is an election year, right? So we're able to pass that this year. So if you're a state employee, you got your bonus in April. Local employees whose jurisdictions participated will get their bonus in about 10 days or so. So that's what we do. It's a great organization. Membership is nominal at $8.75 per month. So join, get involved, because we're there for you and working for you. And we have a great staff and we enjoy it. So thank y'all. Have a great day. I want to ask you to do one more thing. Find somebody in here you don't know. All right? Find some. Make it a goal today to find at least one person, maybe two. Build your own personal network. Build your brand so that y'all can collaborate, okay? That's what life's all about. Thank you. God bless you.
All right, thank you.